The Center Square's Voters' Voices poll shows a majority of voters are favor in a federal ban on transgender procedures for minors. Welcome back, Illinois in Focus Daily. Like, subscribe, hit that notification bell, and you can see the story here about the Voters' Voices poll through the Center Square. And most registered voters, 59%, support a federal ban on transgender procedures such as puberty blockers and gender reassignment surgeries for minors. We'll delve a bit more into this, but we do have numbers from the organization Do No Harm highlighting how prevalent this is. So let's check that out here. And the database is called the Stop the Harm database. So you can go to the website, which is stoptheharmdatabase.com, and you can see this for yourself. But let's take a look here. You've got the entirety of the country covered. It looks like they gave 3 different categories: the Dirty Dozen hospitals, other states that allow gender-affirming care for minors, Illinois being one of those, and states with age limits on gender-affirming care for minors. What they did is they delved into data from insurance companies, looking at a variety of different metrics and all of the things that they have when it comes to filing a claim for insurance. These databases apparently are sold, and they may be made anonymous, but still you can see some of these numbers. So you can click through and check out all the various states, but for Illinois, it breaks it down saying there's 418 total sex change patients. And again, these are minors, children. 211 total surgery patients, 212 total hormone and puberty blocker patients, and total prescriptions written 1615. So 1,615 procedures. Total submitted charges $644,000. And this is just from 2019 to I think 2023. But we know that this is something that's been happening at least at one particular institution, Lurie's Children's Hospital in Chicago. They talk about on their website how they started this back in 2013, and some of the things that they discuss include gender expansive or gender nonconforming children getting these types of treatments. You've got gender questioning youth, transgender and gender fluid youth. In their philosophy, they say, for even the most loving, affirming, and resilient families, navigating childhood gender identity developments can be confusing. It can become more challenging as our patients and their families encounter difficulties posed by others, including extended family members, school officials, and other community members. We navigate these challenges by providing our families with education, exceptional and affirming clinical care, support, and ongoing consultation to ensure that children and families flourish safely in the environment that is both nurturing and affirming. So it goes through and talks more about all of the different services and how people can get their children into these services. But we'll talk a little bit more about some of the things they have to say and some of the totals that they share, including more than 2,000 families they say have been assisted by their program. But I connected with Awake Illinois founder and president Shannon Adcock. She's a parents' rights organization here in Illinois, not part of Do No Harm, but we talked about the Do No Harm numbers and how what's her reaction to these particular numbers.
Sure. Well, Do No Harm is a great nonprofit organization, and they are pretty new relative to advocacy organizations, but they hit the ground running and compiled a really great group of physicians, pediatricians, parents, mental health professionals, all who share the concerns over what is happening with the medicalization of children under this harmful term or phrase called gender affirming care. And so this database is the first and only across the country where parents can finally learn who are the practitioners engaging in this medicalization of children that has already been stopped in Europe at Tavistock, that closed their gender clinic. And now people here in America are waking up to the harms that have been done to patients around the world. And it will be stopped here. And I believe this Stop the Harm database, again, the first and only of its kind, is going to help parents know which providers they should avoid if they share these concerns over this practice of medicalizing children.
So talking with Shannon on Friday, talked about the method that they put out. Do No Harm putting together a white paper explaining the types of things that they collected to provide this data.
They do. Well, it was a really intensive dive, and they had people who are practitioners, medical practitioners, mental health practitioners, look at the billing codes, look at the ways in which these gender clinics and hospitals and practitioners were getting compensated for puberty blocker prescriptions, for top surgery removal, where girls have their healthy breasts removed for gender reassignment, where genitals of children are being modified, so many different things that are affecting their endocrine function, their hormones, and their physical growth and development. That again, physicians around the world have sounded the alarm. They continue to. And so Do No Harm has compiled this with, again, a pretty intensive dive, very highly credible. The numbers, at least out of Illinois, certainly where we are very conservative. So they wanted to make sure that the data was good in terms of how they were compiling the patient totals and the compensation totals that were billed by these clinics.
And again, Adcock saying conservative numbers. Let's take another look at those numbers where 418 total sex change patients in Illinois, 211 total surgeries, total hormone and puberty blocker patients, 212. $644,000. And again, this is from 2019 through 2023. It even breaks down the hospitals in Illinois conducting these types of operations on children, and Lurie's Children's Hospital being top of the list with 274,000. But people can actually go through and find all of the various clinics and hospitals that are doing this. And there's 5 pages worth of hospitals that are actually, I think it's more than that. Let's see here. It goes all the way down to 7 pages worth of clinics in Illinois that are doing these types of operations. But does it go far enough? Does it actually tell the whole story? Adcock saying good first attempt here, but there's a lot more going on.
Well, it's a start. It's a start. Yeah, it's a start because this data is actually compiled from 2019 to 2023. And for example, in Illinois, Lurie Children's Gender Clinic opened in 2013. And in 2016, the director of that clinic said that they were struggling to keep up with demand, that they had hundreds of families who were wanting this gender transition medicalization done to their children, or were very concerned about the mental health issues with their children and were guided wrongly down this path. And we've now uncovered so many of the harms that have been done to patients. WPATH is another organization of physicians that have pushed this medicalization of children. And so when you look at how this data only goes back to 2019, it does not cover out-of-pocket patients who did not use a healthcare provider or insurance rather, or Medicaid. And also Kaiser, which isn't as big here in Illinois, but around the country, they weren't able to include that data because, again, they wanted it to be proven, they wanted it to be good, but out of pocket is not covered, and anything before 2019 isn't covered either. So again, this was very conservative, but we know that primary care doctors are being referred from Lurie Children's to handle this type of procedure, medicalization of children, whether it's puberty blockers or consulting for surgeries. So it's not all necessarily going to be billed under a hospital per se. It could be these satellite clinics or providers who are doing this medicalization of children.
So when talking with Shannon, she also is pretty knowledgeable in how this has gotten to this point. What's driving this push for young people to change their gender, to get hormone therapy, to have surgeries done? What's really behind this?
There are many things driving this agenda, and much of it is misinformation. And that's also on the part of providers, it's on the part of counselors, and it's on the part of parents, because lies have been told for several years now, rooted in terrible, terrible case studies that have had no integrity whatsoever. They have been absolutely, criticized by doctors. The gender clinics that were using these studies in Europe were caught, basically. These studies had absolutely no integrity to them, but there was a lot of money invested in the medicalization and sterilization under the guise of gender affirming care. So there's a lot of profit to be made. There's a lot of money that rolls into this. And oftentimes patients are on treatment for life because of how disrupted their endocrine function is. Their hormones are so disrupted that they end up having to be on pharmaceuticals for the rest of their lives because of the trauma done to their bodies. Now, when you look at the trauma done to children, a lot of times this is happening from what could be conceived as a contagion in a way where there are confused children, they're in puberty, and they're in a school or in a setting where it is celebrated to be confused about your gender. And it leads to these pathways, whether it is through sexual education in school or counselors who think it's very noble to talk about gender reassignment and all of these medicalization and sterilization procedures. It starts with a conglomerate of things, many different influences, social media. But the concern is that the lies are being told to parents, to children, that this is somehow healthy for their growing and developing bodies, and that science has been debunked. And yet, the Stop the Harm database is showing parents that there are practitioners who continue to double down on the harms of this medicalization, and they need to know where they may want to avoid taking their children should they be confused, should they be dealing with mental health issues. Parents do not want to see their children wrongly harmed as they are growing into adulthood.
And again, we're talking about youth here, not adults. Adults making their own decisions on whatever kind of procedures they want to have done to them, elective procedures that they want to have done to them. This is focused on children. And again, back to the voters' voice poll from the Center Square, most registered voters, 59%, support a federal ban on transgender procedures such as puberty blockers and gender reassignment surgeries for minors. Strongest support for a federal ban came from registered Republicans, while the lowest amount of support came from registered Democrats. Independents, they offered a major support for a ban with 56 in favor. So again, that's a survey of 2,600 registered voters across the country from Noble Predictive Insights. So, back to Adcock here, some other thoughts that she had about where we're at in this space.
Parents in Illinois, unfortunately, have to work so much harder than in other states that do provide protections to children that prohibit this terrible medicalization of their bodies, their sterilization of their growing bodies. And so in Illinois, young children could potentially get access to any number of resources or lies that are perpetuated, whether it is in a public school, whether it is via a counselor, or their peers. And so I think it's really important that parents absolutely start talking to their children from a very, very young age, and also vet their pediatricians. Look at the WPATH list of doctors in Illinois. If your pediatrician or primary care doctor is on that list, do not go to them, because they are going to engage in this horrible medicine known as gender affirming care, which will be stopped. It will be stopped. But parents have to be so vigilant in a way that perhaps they might not have to be in other states. But across the country, Do No Harm organization, through this Stop the Harm database, they are absolutely empowering parents to pay attention to the practitioners and encouraging parents to be the barrier between your child and any influence that's going to try and indoctrinate them into these lies that's harming patients. So January Littlejohn is a friend of mine. She is with Do No Harm. She had a child that was at school, and counselors wrongly kept secrets from her, from the mom, from the dad, and they tried to socially transition the daughter. And January says parents need to inoculate their children against this agenda from whatever direction they're seeing it, but to be mindful of the practitioners who are engaging in this medicalization, which is so very harmful. Parents have to talk to their children about this from a very young age.
So again, one of the top clinics that provide this service in Illinois, Lurie's Children's Hospital in Chicago. And if you look at their website, they have a post from 2023 that says, study, gender affirming hormones improve mental health in transgender and non-binary youth. And they say the evidence is from the largest study in the U.S. on the impact of gender affirming hormones with longest follow-up. And it goes on to talk about the results and says many transgender or non-binary teens experience gender dysphoria or persistent distress caused by discrepancy between their gender identity and physical appearance. Gender affirming hormones are used as treatment to foster gender congruent secondary sex characteristics such as breast development or facial hair. So it goes on to talk about this study, Lurie's Children's Hospital, saying that the study is including 315 transgender and non-binary youth between 12 and 20. Goes on to talk more about what they found overall. Appearance congruence, positive effect, and life satisfaction increased, while depression and anxiety symptoms decreased. I'm curious what the longest term care for is in this space. interesting to see both sides of this, but, as was discussed by Adcock, this has been, put to a halt in Europe, and you've got other countries that are banning these transgender procedures on children in their countries. This U.S. has a patchwork of states, obviously, but Illinois, allows for minors to have these procedures and hormone blockers and such. Adcock saying that it's imperative that people keep an eye on what's going on in Illinois with these types of policies.
Well, when we did the enormous advocacy grassroots lobby effort against House Bill 4876, which was filed by Rep. Ann Stava Murray in the 81st District, right now she is getting a lot of criticisms from her district and from the state when she leaned into this agenda that would have changed the state code to call parents child abusers if they did not permit medicalization and sterilization of their children under this gender affirming care, this horrible, evil, harmful agenda. And so I think that when that was filed, that was a wake up call to many Democrats who saw this as a losing issue. They do not want to be on the wrong side of the parental rights battle. They do not want to be perceived as critics of parents who are, have the fundamental rights to raise their children and to handle their medical care and their education. So Ann Stava Murray got, I think, so much pushback that this is an issue that, of course, we're going to keep very close eye on. I think if Ann Stava Murray gets reelected, she will still try and double down somehow on this agenda. But she didn't have a ton of support when it came to this particular issue of going against parents who are concerned for their children right now on this issue. So we're going to keep a close eye on it. But in my opinion, you look at what's happening with women's sports around the country, parents and citizens are really unifying on this issue of getting back to basics. Biology matters. There are males, there are females. There are growing bodies that deserve to be protected and to go through normal puberty and to grow into adulthood without medicalization and sterilization and all of these harmful applications that are being done by these clinics. So parents have to go to the Stop the Harm database to get as much information as they can to protect their children.
Again, I appreciate Shannon Adcock talking with me about this controversial issue, no question, and we'll be watching as to what kinds of developments there are in this space with Illinois in Focus Daily and the Center Square. Get the podcast anywhere you get podcasts. Just search Illinois in Focus and subscribe, hit that notification bell to wake up with us each and every weekday morning for America's Talking Network. It's Illinois in Focus Daily. I'm Greg Bishop. Appreciate you taking the time with us.